But today, obviously, we're here to talk about the nonprofit space and the impacts of the COVID-19 crisis on this space and how organizations are moving forward over the next 90 to 100 days and to come out of this stronger and in a position to build more long-lasting, valuable relationships with their donors to fund their critical missions. And we're very proud at Merkle to have a strong nonprofit practice. In 2019 alone, we raised more than $165 million from over 2.6 million individual donors. So we're very proud of that practice. And I'm also very proud to present today's panelists. We have this panel of esteemed clients from some of the nation's leading nonprofits who have volunteered their time and expertise to provide the perspective on that, on the COVID-19 crisis and what we think is going to happen over the next 90 to 180 days and how we're orienting our organizations to be able to come out of that from a position of strength in this new normal, whatever that ends up being. So today we are joined by Jessica Winters from the National MS Society. Jessica is the Director of Direct Marketing, and she drives enterprise growth by driving revenue and acquisition through both online and offline channels. And a little bit about the Society's response to COVID. Right now, they're really focused on the health and safety of people with multiple sclerosis and their families, which is their top priority as they move through the COVID-19 pandemic together. MS does not stop because of this crisis, and neither will we. MS Society shares the most accurate and reliable guidance possible to help people with MS find their best path forward through this unprecedented crisis. From the Northwell Health Foundation, we're very pleased to be joined by Sue Monroe, Associate Vice President of Constituency Programs. Sue currently oversees all constituency development activities, including signature fundraising events, educational seminars, cultivation and local community events, direct response programs, annual fund appeals, and corporate and individual sponsorships, peer-to-peer fundraising, and cause marketing initiatives. And you heard a word in there that is certainly a hot button issue, I think, for everybody on the call, and we expect to have a robust discussion, is this concept of events and how we're evolving and how these organizations are evolving with the cancellation of so many in-person events and the revenue impact because of that. If you've picked up a newspaper over the past 6 months, you've probably seen Northwell's name in it as it relates to their being the largest healthcare provider in New York State. They are making a difference by diagnosing and treating the most COVID-19 patients in the world. And they are sharing what they're learning on the subject. They are making a difference because they can analyze more data points, ask more questions, and see the broadest picture possible because of their patient volume and an exceptional clinical team bolstered by the Feinstein Institutes for Medical Research. And lastly, but certainly not leastly, we are joined by Angelique Rothermel from World Vision. Angelique is the executive director of World Vision's in-house creative agency, responsible for brand and creative strategy for the nonprofit's U.S. marketing and fundraising efforts. So I'm glad to have a creative perspective here. World Vision is now implementing the broadest emergency response in its 70-year history, with a presence in 100 countries. Every World Vision office across the world is now responding to COVID-19 in one form or another to protect vulnerable children from the impact of COVID-19, not only from the virus itself, but from the secondary effects they are already seeing on the lives and livelihoods of many families. World Vision has already reached more than 5 million people, including 2 million children, through its global health emergency response. So again, thank you, Jessica, Sue, and Angelique for joining us and all the great work your organizations are doing. We have a great group of folks on the line here who are trying to learn what some of the leaders are doing in this space and bring that back to their own missions and provide the critical support and care for our society that we need. So looking forward to a great conversation. So I thought I would start with kind of some specific questions for each organization and each individual on this call, and we'll open it up to some roundtable discussions as well. And if you're on the call, please don't hesitate to enter questions into the chat box. At about 45 past the hour, depending on the timing of this, we will ask some of those questions of the panelists here today. And as Zoe said in the introduction, If we don't get to your question today, we'll be certain to follow up with you over the coming days. And we'll also have this webinar available as an on-demand asset on our website that we'll send out as well. But just to get a lay of the land for each organization represented here, I'm going to start with you, Sue, if you don't mind, at Northwell. Given that you are really at the epicenter, the belly of the beast, the eye of the storm, whatever you want to call it in the United States, how are you really leveraging that firsthand experience in dealing with COVID-19 and these life and death situations? And how are you translating that clinical and care experience into fundraising, stories and calls to action and things of that nature that enable you to engage with your constituents and raise money?
Yeah. Well, first off, thank you all for having us today. It's certainly an interesting time for all of us, and I look forward to hearing what our colleagues across the country are doing in this very unique situation that we're in right now. As Colin, you alluded to, we are the largest healthcare system in New York State. We are also the largest employer in New York State. So everything that we do not only affects our community, but our employees are our community as well. We currently have 23 hospitals, 800 ambulatory sites, and over 77,000 employees. So this has certainly impacted us on multiple of levels. But at Northwell, because of our size and our bandwidth, we have always been at the forefront of emergency response for situations like Ebola or situations like Hurricane Sandy. And as a result of that experience, we have really developed a very cutting-edge approach to how we deal with emergency preparedness. We have a command center that at this point can actually project where incidents may happen and enables us to respond in a very rapid way.